Hello, everyone. No, we'll give it maybe another 2 minutes to get everybody on, and then we'll get started. If you want to begin by putting your name in the chat along with your role or organization, that would be great. I know we have a few people on vacation this week, so we might have a lighter group. Okay, so just a couple, again, put your name in the chat and your role. That would be great. That's how we'll do introductions today. I just want to acknowledge that we are ending at 11:30 today. I know Anna and I realized at the same time today that we had sent an agenda that goes till noon. I think we'll have enough time for most of what we planned on, and we can move some of the end things to our next meeting in August if we don't have time. So we definitely are ending at 11:30 today. Sorry for that confusion for sure. That was my mistake. And then I just want to review the agenda. Anna is going to lead us through sort of an update of the 2025 ELD legislative priorities, and we're going to begin the work for what will be our priorities and recommendation to the State Advisory Council for 2026 today. And we're happy to have some folks from Head Start here today to give us sort of an update on where, as much as they know about what is happening at the federal level to their funding, the impacts, and just to lead us in giving us some information and then leading us in some discussion and opportunity for questions. And then if we have a little bit of time, we just want to start talking about some transition for the ELD committee and begin those conversations. As some of you may know, Let's Grow Kids will be ending. My last day will be October 3rd. So September will be my last ELD co-chair meeting. And so we'll start to think about what might be a transition for that role. So those are some things. If we don't get to that, we have next month. We could spend a little time thinking about that too. So with that, I will turn it over to Anna, and I am going to put the agenda in the chat again for those of you that joined after I did it the first time.
Great. Thanks, Sherry, and thank you all for being here with our kind of wonky schedule this month. I am going to lead us in our first of several policy recommendation conversations as a committee, and welcome any kind of questions or interruptions as I go. I am going to share my screen, so just bear with me for a moment. Okay. Hopefully folks are seeing those slides. So I'm just going to walk us through fairly quickly here to ground folks in a reminder of the recommendations that our committee, alongside other committees, supported last year, that are specifically related to the Early Learning and Development Committee. We'll then kind of take a look at the process we used last year to develop recommendations and kind of ground ourselves in how that works, and move towards a similar process this year. So up on the screen now, folks should be seeing our first kind of group of policy recommendations related to ELD that were endorsed by the State Advisory Council last year. These were related to pre-K. There was kind of three components of this that are summarized here related to maintaining mixed delivery, tasking AOE, CDD, and BBF with a monitoring and accountability protocol, and sustained funding related to kind of data management activities and roles. Several of these, namely that first one, were renewed policy recommendations. We've had kind of a recommendation related to pre-K, specifically related to maintaining access for 3 and 4-year-olds in a mixed delivery system for the past several years, since that's kind of been on the policy making radar. So those are our first recommendations to review. Next, we had a recommendation that was supported by this committee, but also by the Child Outcomes Accountability Team, or COAT, which focuses more on Goal 1 of the strategic plan, related to access to CCFAP particularly for TANF eligible children and families, particularly those experiencing homelessness. And interest in developing or establishing a presumptive eligibility policy. This is something, I should have noted kind of related to pre-K as well, kind of progress or lack thereof. As we know, pre-K is still kind of a evolving piece of policy, given the education transformation conversations that happened this last legislative session, and will likely continue to be something that is up for discussion. There has been some progress, I would say, related to that second. Let's see if I can go back. The second piece here around a monitoring and accountability protocol. We do currently have a constellation of AOE, CDD, and BBF partners coming together to work on some next steps related to that monitoring and accountability protocol. So there's action in that area, which is exciting. But otherwise, I would say there hasn't been real meaningful progress related to this. Progress related to the presumptive eligibility policy. This wasn't something that there was movement on this past year. We've also had some good conversations with the CDD team about whether or not this is truly necessary, given other policies and practices that are already in place to support TANF eligible families and families experiencing homelessness with becoming eligible and enrolled in CCFAP. So kind of an evolving conversation, but no tangible kind of legislative or policy progress on this. And then finally, the piece that this group perhaps wrestled the most with was a series of recommendations related to investing in inclusion, investing to ensure inclusion and meet social emotional health needs and early education after school programs. So again, we kind of had a three-pronged recommendation here. One piece around ensuring that early educators have access to sufficient support staff and exploring kind of some specific strategies around that related to recruitment and retention. So we had listed the student loan repayment assistance program here and some other pieces. The second piece was prioritizing investments in teaching practices that are developmentally appropriate and increase the capacity of the workforce. And then finally, a piece around the importance of ensuring that historically marginalized populations don't disproportionately experience discriminatory and exclusionary practices. And this piece, as folks know, is the one that I would say, struggled to land on the most. I think there was the first piece, I think we had really strong kind of consensus around the importance of support staff. But otherwise, I think we struggled a bit to land on kind of specific strategies that there were strong agreement on amongst ELD and other kind of network partners. So I think this will be something for us to continue to monitor and think about related to conversations that are happening related to the strategic plan as well, and existing models and practices like early MTSS and other things. So just to name this piece has been a challenge and will continue to be something I'm sure we discuss. Okay, moving us along a little bit, just to remind folks of kind of one of the ways in which we landed on those recommendations. Last year, we had a similar conversation to this where we kind of introduced the policy recommendation process and brainstormed some initial ideas. Those initial ideas helped the BBF team develop this kind of pulse survey to get everyone's kind of feedback on what was resonating for them at the time. So we developed the options that you're seeing on the screen here. These are last year's ELD committee members' responses. And then we came back together with these responses and information in hand to have a conversation where we landed on the areas that I just went over and kind of workshop language a little bit more specifically. We've gotten fairly good feedback, I think, and engagement in that way of engaging in the process. So our plan is to do that again this year. This again being that kind of first initial introductory conversation where we kind of get ideas out on the table. I will then take those ideas between this July meeting and our August meeting, circulate a survey, super quick, again, kind of just like a pulse gut check kind of survey. And ask that folks come prepared for our August meeting to have a little bit of that richer conversation while we look at our results. So you can see based on last year's results, pre-K again was really front of mind for folks, as was that piece around inclusion and supports for early educators. And then we kind of otherwise were split across the board with some interest in exploring a recommendation around workforce, some interest in a recommendation around CCFAP, an interest in Part B. So we will see where the wind takes us this year, but just wanted to kind of remind folks of the process and what it looked like last year. Okay, and then very quickly, we don't have time to kind of dig into the draft of the strategic plan today, and many of you have engaged in conversations recently with our team related to providing feedback on the updated strategic plan. But do just want to kind of ground us and remind us that as a committee, we are really focused on what will be the new goal 3, which is that children and families have access to high quality opportunities that promote child development and well-being. And these are kind of the 2 main goals under that, with many kind of objectives nestled under them. So just wanted to kind of remind folks of our charge, which really is early learning and development, including things like early intervention and supporting children with disabilities in early education settings across settings. So I believe, let's see, yes, I believe that is it. I will pause there and see if anyone has questions before we just kind of open the floor for a couple. I'll kind of prompt folks with a couple of questions related to policy recommendation ideas for this year. But any questions on that? Sharon, go ahead.
Thanks, Dan. That was great. I really appreciate the overview and the recap. It's, it feels like a long time ago since we had those conversations. I'm curious, and maybe you're going to get to this, how this discussion relates to the work that's happening with updating the strategic plan, and if any of the components of that strategic plan actually should be part of this conversation as well.
Yeah, that's a great question. And I think Kate Bailey is on or was on, who's leading our process to update the strategic plan. There she is. We are kind of actively working across teams at BBF to make sure that kind of the right strategies are slotted into the right document. That being said, I think that there's been a lot of really interesting conversations about how many of the pieces that are in the draft of the VCAP could be considered as policy recommendations, the things that are kind of the most ripe for movement in the next year. I don't think that there is any problem with that. I think that ideally everything that we come up with within the network as policy recommendation ideas are at least rooted or aligned with the VCAP draft in some way. If they aren't, I think there's something to be said for reevaluating either the draft or the recommendation itself. So ideally there is really strong connectivity. We don't want anything, I don't think, verbatim in both, but it's kind of an evolving thing and something that we're kind of keeping an eye on the back end, but also open to feedback on. Kate, I don't know if you have anything you would add to that.
Yeah, thanks, Anna. I think just quickly, the way I'm thinking about it is that the strategic plan is the framework and it's setting the goals, and the policy recommendations is one of the ways that we're implementing and monitoring and going more specific, because their annual strategic plan is a 5-year vision. When we're talking about those big picture pieces, that's getting funneled to the strategic plan update. When we're talking about more of the year to year, really specific strategies, programmatic work, that's getting funneled more towards the policy recommendations process. So hopefully that helps.
Thank you.
Great question. Maggie, do you have a question?
No, I'm sorry, I unmuted myself inadvertently.
Not a worry. Not a worry. All right, any other? Yes, Beth.
Sorry, I have a question, and I was trying very hard to raise my hand, but I couldn't find it. I've done this before. I know how to do this. Hi. I guess I have one, maybe two questions related to so do we want the policy recommendations to be sort of our optimal ideal state, or do we want them to be something sort of realistic and possibly achievable? So that's one kind of question. I can pause there and then maybe come back for a second if time allows.
Yeah, it's a great question. It's a big question. I think that the way that we've conceptualized it, and I think this is fairly aligned with how Kate just described it in relation to the strategic plan as well. We really want, ideally, the policy recommendations to feel actionable, particularly since they are in documents that we share with the legislature and urge them to consider related to what the biggest priorities are for children and families this year. I think ideally they're things that are pretty tangible and, if not politically viable, at least ripe for meaningful discussion and debate. So that's something that we've kind of tried to hold in the process. I think that there always is a little bit of a tension, though, between the ideal system that we all kind of envision for children and families and what is doable, particularly in the kind of political and fiscal environment in which we're existing. So I welcome other thoughts on that, but that's my initial reaction.
Bev, what do you think about that?
I think it feels just right to me. A little aspirational, but also still pretty tangible and achievable. And also, I like your idea of advancing the conversation by at least putting it on the agenda and hoping to talk about it, right? Continue to raise awareness and give legislators an opportunity to take testimony, put forward, talking, one pagers, whatever. Yeah. So I feel that feels right on point to me. My other sort of semi-related question, and I don't want to step on anyone else's time here, but is the question around um, where's the place to talk about the how the policy recommendations would be implemented. So there's still pretty high level policy recommendations in terms of the like, what's the action? Are we looking for a change in the law? Are we looking for a change in the regulation? Like a little more specific about, yes, we'd like the system to support universal access to UPK. What does that look like? So maybe that looks like adequate funding in the budget. I'm not sure. And so where and how do we get to the how? Where's the right place to get to the how? Is this document the right place?
Yeah, I think that's another great question for the group to wrestle with. I think that as you all know, Building Bright Futures as an organization kind of walks the line in terms of kind of the level of specificity that our recommendations endorsed by the State Advisory Council can have or can hold. I think things like we always say that we as an organization don't support or oppose directly any piece of legislation. So things related to like the budget bill or other kind of specific pieces of legislation are harder for us to advocate for directly. And I think that that's where our network of partners can really play a role in taking a BBF policy recommendation and making it a little bit more tangible for folks in their own capacity. So but I think that being said, like there are recommendations that we have moved forward and endorsed that like have played it too safe or have not gone in a direction where they provide enough kind of tangible ideas about strategies that like they could be acted upon. So I appreciate the point, Bev, and I think it's something that we're kind of always kind of aware of and playing with what that line is in order to make sure that the recommendations are meaningful, even if they are not explicitly advocacy oriented. Any other questions?
Those were great questions, Bev. I think I do think that's something for us to think about as we're making our policy recommendations, because there may be an additional level that we can dig into. I just, like in some cases, our policy recommendations, maybe it does take legislation, like maybe there's more about the how that happens. So is it legislation? Is it in some cases a rule change? Is it a shift in investment? Like there may be some ways to dig in a little bit where we're not specifying necessarily what should be done, but more like how it could happen. So I think that's an interesting point in thinking about a little deeper level to our recommendations.
And I love that, Sherry. And I would just, as you were talking, one idea that popped into my head might just be in future agendas after the policy recommendations are set, maybe how this group talks a little bit about what work is happening, who might be taking up lead on some of those initiatives. So maybe it's some of the how as a conversation in this group, to just sort of not put the recommendations out there and then come back a year later and see how anything happened. But maybe a little bit more of connecting, like just acknowledging, like, is anyone doing anything about this? Like, and if not, like, what would you need? What kind of support might you need to do that? Or I'm not sure. I'm just kind of brainstorming here. I'm feeling safe with all of you, so I'm making stuff up as I go.
I love it. All right, any other questions before I prompt us with a little bit of brainstorming for for 2026 Policy Recs, which is great. It's wild to think that we are working on something for 2026. Okay, well, we have about 20 minutes of this section left, so I'm going to pivot us into that space, but we can certainly kind of move back into the questions and brainstorming mode as well. But yes, I really just want to open the floor. This is, as I shared, kind of flipping through slides, this is really the chance to kind of put things initially out on the table. They don't need to be fully formed ideas or with specific fine-tuned language. We're really just looking kind of for initial curiosities of things that could be policy recommendations. And I would really encourage us to think about the presentations and conversations that we've had as a committee over the course of the year and what ideas those might have sparked. But similarly, kind of what is front of mind politically, and what feels ripe for a recommendation from this committee and from the State Advisory Council. So really just kind of want to open it up, and I will be capturing notes that inform the kind of menu of options that I put on that survey for everyone.
And I just want to add that don't feel like you have to have like a fully formed policy recommendation. Like, feel totally free to say, I think we should dig into topic X a little more and come up with a recommendation. So I don't want anyone to feel that we're looking for perfection here. We're just looking for reflection and a start of what we'll dig into to be more specific next month. And
Hello. I was just thinking about like what systems do we need for these goals to be successful that aren't in place, and how does that play a role in policy recs and or funding for them, things like that. I was just thinking of like child outcomes. Like, what do we need in place to really track child outcomes, to track how systems that are in place in early ed are then playing out in K-12, and what do we need in place to really be able to track those goals, to have enough data to let us know how we're even doing on them.
thanks, Alyssa. So sort of what systems do we need in place to track our progress toward the goals that we're identifying or the recommendations we're identifying? That's great.
Yeah, let me know if that doesn't make sense and I can ramble a little more. Okay.
Sharon.
I am trying to leave space to not monopolize this conversation. So I was waiting patiently. I think this is, this process was the first time for me last year. And so I was sort of a little blind. And so joining the conversation early is going to be super helpful. And I think that, being late to the conversation and understanding the process, I wasn't as prepared. And I think that, there are lots of ways to approach this, but I think we talk about, early childhood development and that being our priority. And I have a couple of things that are going to be pretty obvious that I'm probably going to say. So one, it's about, using the language of early childhood education and care. I think early childhood education should be the lead in how we talk about our work, and also really focusing on the importance of the educator. And I think that, we have had lots of conversations over many years about clear stackable preparation pathways, how important that is, and how that's going to lead to career advancement, which ultimately could potentially address some of those workforce recruitment issues you're talking about with specializations like occupational therapy and early childhood mental health. So I think that having a goal specifically related to our vision for the workforce should be a priority this year. I agree that we're not done with UPK. There are lots of things we're not done with, but I think that was a missed opportunity last year when that is consistently what we're hearing as the highest priority when we're working with programs and early childhood educators directly. So how that might look, I understand like there's not consensus on what that should be, but I think that should be something that we should dig into. And I actually think that this is going to be a session that we could make good progress on that. So I think that not surprising, that's what I'm going to flag.
Thanks, Sharon. Other thoughts of topics? I think, Anna, I do, I do think universal pre-K is something we should dig into in the next session as it's called out in the education transformation bill, as there were the recommendation from the report from the committee. None of those were adopted. So I think that should be on our list for consideration for sure. I also, kind of piggybacking on what Sharon said, one thing I think language is important, and I think what Sharon, a lot of the language we're using in Vermont is around early childhood education now, and care, early childhood education and care. And I noticed that the language in the BBF goals is early learning and care. And just thinking about, language matters and consistency matters, especially when we're talking about legislators, so they know we're all talking about the same thing. So I think that's something else to consider. And I say that with hesitation as someone who was part of this committee, that it took us like 3 years to agree on what quality meant. So I'm not saying that's an easy task, but I do think it is an important consideration that we're coming up with language that we agree on.
I just want to add something to what you just said, Sherry. So in the professional development survey this summer, which I'm working on data, by the way, I'll share as soon as it's ready. I intentionally took out some of the choices in the list of what is your role? And I tried to make sure I was still being really inclusive and expansive, so that folks could see themselves. But I really took out roles based on your program type and put in early childhood educator, early childhood support staff / assistant / whatever. So I tried to still be expansive, but I will tell you, in the open responses, the number of people that wrote in family childcare professional, no, family childcare owner, daycare staff, and licensed educator, the need that folks had to differentiate those and not see themselves in the title of early childhood education was still super clear to me in the data. So just to sort of echo the point here of the need for the consistency and for us to continue doing what we're doing to really help hold everybody together in some of these definitions.
Thanks, Becky. That's it. That's interesting. Thanks for sharing that. That's an interesting perspective from your gathering. Beth?
I'm so excited. I found my hand. Okay. I raise a hand. So I really want to echo what Sherry said about universal pre-K and having some recommendation related to that, because my understanding is that the House Human Services Committee is going to take this up and it's going to be a priority of theirs. Now, that said, there's a lot of things going on that may change that. But if there's a committee that seems committed to talking about this, it feels like there should be some recommendation from BBF, some position.
Thanks, Bev. So the topics that we've identified just now, we've talked about universal pre-K, we've talked about early childhood educators and the workforce. What are other topics that come to mind? And Alyssa talked about the systems in place to track progress and where are the gaps there. What else are people thinking about as we look to starting this fall, 2025, 2026, and developing our policy recommendations, our topics or gaps that we're seeing that are impacting the ability to fully meet our goal?
I was just thinking of, I don't know, just about, right, like still that need to protect Act 76 and the intention and the funds that have come from Act 76, both through the budget and budget reconciliation, and just how do we make that really strong and ensure that that those funds are protected, and that kind of true ambition of Act 76 is fulfilled. The infant toddler increases are amazing that happen for this year, and we still have ways to go. So that work, just that concept of that work isn't done. So.
Thanks, Linda. I'll just say I would really encourage folks to be thinking about, related to that, how they'd like to see kind of the concept of protecting funding, protecting and ensuring that there's sustainable funding represented in this year's policy recommendations, as I think that's going to be kind of a challenge and a focus point. And we're hearing from our Head Start partners here momentarily, but going to be a challenge kind of across goals and across programs. So would really welcome folks' feedback related to Act 76 and CCFAP, but also more broadly about how the policy recommendations acknowledge kind of the fiscal environment in which we're living.
You said CCFP, and this might not be a bigger policy thing, but won't there be a bill that gets picked up that makes some changes to that so that it's in line with the federal regulations, right? So I think about like that, the attendance piece, like how that system will work, and really concerned about the CDDIS being able to do it in line with federal guidelines, and the C codes that was put into place this year was a nightmare. And just, I would hope that somewhere along rulemaking or something that is changed, or that is easier for families to request. It's more days. I don't know. The whole system was a nightmare.
Thank you, Linda. I think I was thinking the same thing related to what Alyssa keeps moving on my screen, but Alyssa, sort of along that same lines, as we have had some expansion of CCFAP, we've had some different changes to that. And I do think, I hear from parents and I hear from programs about the things that are not working. Like they're really happy when they're eligible, and that's news. I hear from that too, but there's some components of that aren't working well for families. And so I think that might be something, because it really does relate to access for families to meet our goal. So I think that would be something good for us to dig a little deeper in. And this is an example where I don't think we have like a perfectly formed policy recommendation, but it's something we should consider.
Hi, Sherry, can I chime in? My apologies for a broken camera. I just want to follow up on Linda and what you also just said about that things are working. And, I understand it all comes down to funding, but I'm just going back to Sharon's observation about language and thinking that, protecting funding isn't the same communication as protecting that things are working for the families in the way that they're intended. And so we just suggest that we do some work on coming up with what is the right language to achieve securing that funding that ultimately makes it all happen.
Thanks, Eddie. We have a few more minutes for those of you that want to add to the conversation. And again, it doesn't have to be a perfectly formed thought. It can just be, this is something I've been thinking a lot about.
Sherry, this is Cynthia. If you don't mind, I'll pop in. I did put something in the chat as well, but as this conversation develops and thinking about the next several years from the federal perspective, I can share that, Vermont Feed and sort of the Farm to world works with Action Circles, and Action Circles is a legislative, lobbying body that helps us do some of our work, but they're suggesting that partners really come together and start having really tough conversations about prioritization given federal impacts. And as I listen to this list, and as I too am thinking about, to some degree, preserving what's been working really well, and if we can accelerate that or expand that, wonderful, but at the very least, preserving what's working well within the work that we've done in very recent years around Act 76, around workforce, around some of those really big pieces that we know are by proxy, they bring along other aspects of the system in child development and child well-being. I just wonder if BBF and this structure, if we also need to think about how to have those really tough discussions that, when we lose billions of dollars in federal funding, like, how do we really prioritize these recommendations so that we ease the burden on our legislators? I think our legislators in the next several years are going to have to be working very, very hard to meet very, very challenging state needs. And I think we owe it to their amazing work to help them by helping them make those tough choices. So I'm just curious where either the rest of the committee, all of you folks, and BBF sort of stands on that as we listen to this laundry list getting larger, knowing that it's going to be really, really tough scenarios for the next 3 years.
Thanks, Cynthia. That's an excellent point. And Sonia has her hand up.
Sorry, my camera is not working. I wanted to just echo what you said, Sherry, around CCFAP. I agree 100% in terms of like what I see that really works well, and the fact that it is creating an accessibility point for folks. Yet there are absolutely pieces that are still very challenging. And so when you said things like, I can think of several things that are challenging, but to me, it's more around educating parents and to understanding the system and what are C codes? Why are there only 30? When you have to do, like, a lot of that falls on the provider to do, obviously, because when you run out, we don't get paid, and that triggers, we don't know when they run out, but when they run out, I'm just giving you an example. And that feels those are all very awkward conversations, how the family share works, all of that stuff. But that's like people power, right? That's not, it's money, but it's also like money that supports people, not necessarily toward the eligibility or toward the reimbursement. So I just wanted to echo, like, that's going to be super important moving forward.
Thanks, Sonia. I want to go to so it's sort of like the strategies or people or those kinds of things. That's a really important point. I want to go to Claire. I want to note that Michelle Treya has put something in the chat which we will capture. So thanks for adding that. And we'll go to Claire and then as our last follow-up for this meeting, but we are going to continue this in August, so it gives you a whole month to mull some of this conversation over and then come to that meeting also with your ideas and feedback. But I'll turn to Claire.
Thanks, Sherry. Piggybacking on what Cynthia was saying, I think at the parent-child center network level, we are acutely aware of harm that will be caused directly to children and families as a result of the budget bill that passed. The Medicaid and SNAP cuts are going to be significant, not only to the state of Vermont's economy and budget ability to pass a balanced budget, but families, the kids and families that we work with, the ones that are in early intervention, the families that are, eligible, just like hanging on to their eligibilities, whether it's like WIC or SNAP or, 3 Squares. It's the safety nets that help people stay afloat and not fall farther back. So I don't need to go on and on. I know we all know the impacts, but as parent-child centers, we're acutely aware and we're like teeing up kind of a lot of like a variety of strategies. And I think it's just really important for us to keep these conversations. Yes, our organizations will be impacted and staffing and bottom lines, but really keeping in mind the families that rely on Medicaid, that rely on Dr. Dinosaur, that rely on Katie Beckett Medicaid for children that are eligible for early intervention, and to really look at who's depending on 3 Squares to make their monthly budgets work and how we hold families up and we keep their stories in mind and don't lose track in sight of like a lofty goal for something that's really, hurting 30,000 Vermonters. Thanks.
Thanks, Claire. Thanks. So we're hearing a lot about part of our job will be that prioritization of the impacts and in our consideration for our recommendations. All right. Thanks everyone for participating in this part of our work to come up with our 2026 policy recommendations. We will continue this in our August meeting and probably slip that into fall a little bit as well, like last year, as we refine and decide what is most important. I think we're going to hear from Head Start now. I think one of our challenges is that trying to exactly figure out what exactly is going to happen and the impacts. And I think we're probably getting closer to that, but it certainly is been really challenging to understand what the impacts will be and what we need to be ready for and how much, for sure. So let's see. I know we have Renee here. I'm looking through my screen.
I don't think Christy is here yet.
Okay.
So I'm hoping that she can jump on, but if not, sorry, y'all, you get me today. And we can follow up with Christy for your on-point questions that I may not have the answers to. So,
well, thanks for being here, Renee. So we'll turn it over to you and make sure Christy's not in the waiting room. and we'll start with you. And anything we need to take back, we can follow up in August or follow up in our notes with questions.
Great. Well, thank you to ELD for having me. It's great to sit in. This is one of the BBF committees I do not have the pleasure of joining frequently, so I've really had to keep my camera off and keep my mouth shut because it was a great conversation this morning, and it's just great to be a little bit of a fly on the wall to hear what you're all considering. I am going to attempt to share my screen and present. And if you could all let me know if this works. I have been cursed with technology today, so are folks able to see my screen? Yes. Okay. And not my notes, right? Because that's what we're all worried about. Is like, oh my God, they see all our terrible notes. Well, I don't think we could have queued up that any better in terms of what you were just talking about, Sherry, the federal changes and trying to figure out what the impact is. My neck is pretty sore these days from all of the whiplash with federal announcements coming out, and it feels like it has been that way since January with the closure of our OHS regional office and all of those pieces. So things are moving in the Head Start world. We have a little bit more information, but really my purpose here today was to try to share with you all where we're at. And while we are uncertain about the future, really want to make sure that folks within this group and within your networks kind of understand the full impact of Head Start and what could be lost if those services, if funding gets pulled back in any way. And again, I put the slideshow together, right? Things have probably changed since last week. So we'll just be graceful with me as we go. But this data too, I just want to share, and Christy's not here to give credit. While Head Start does collect tons of data in all different areas and has been doing so for many years, the Vermont Head Start Association, with all of these federal changes, really did a great job at coming together to pull their data points. They realized that we're not able to wait, right, another year to get this year's data. And so I just want to acknowledge there was a lot of work that went into programs to really trying to get a handle on the scope of our work in the state right now, so we can be messaging that to partners, because as you'll see, if things start slipping and going away, it's probably going to have a pretty big ripple effect and create a lot more work with a lot of limited resources for the rest of folks. So yeah, really wanting to talk today about the essential role of Head Start and really stressing that it goes beyond childcare too. Well, let's see if my advancing slides. Okay, I think we're here. So people hear Head Start, they think they understand Head Start. I've been doing this job for a few years now, and the quickest elevator pitch I can get, right, is Head Start is Child Development Services Plus. Right. And I appreciated the conversation I came into and hearing some reminders about like early intervention, right, and child development services. And our job is about all of child development, right, and not just within center-based settings. So that tickled my ears a little bit, because I think a lot of times folks hear Head Start and they think, okay, we know it's for special populations, but they're really thinking childcare, and Head Start is so much more than that. It really is a 2-generational comprehensive approach. It's an anti-poverty program, right, in my mind. While we are providing child development services for kiddos, we are also providing a whole host of other comprehensive services for families, right? And we know the ecological model, like we can't just serve kids independently. Kids exist within the context of their families and homes. So to do this work effectively, we really need to touch all of those points. So we're really doing that work 2-gen, and sometimes, and I think there's some Head Start folks on, I think I saw Jen on here, sometimes 3-generation, right? Depending on what those family compositions might look like. So when we talk about budget cuts, and just to be very clear, while there was a whole hoopla before the budget dropped about whether Head Start would be included, here we are, Head Start was included. And then the narrative, of course, we know switches because it's level funded and costs are going up and needs are going up. And so we see level funding as a cut. But hey, we were in the budget, so we were happy about that. But really looking at if funding goes away, if that program goes away, not only does that threaten the slots for kids, those child development services, but it really will have a detrimental impact on those connections that families have to the other support networks in their communities. So providing a data snapshot today, some of this data is from past PIR, some data was collected very ad hoc by programs. So always happy to kind of answer questions there. But really my goal is to try to make it clear about the impact of Head Start, and that without Head Start and early Head Start in our state, we're going to face bigger gaps, and it's our most vulnerable families that are going to feel it the hardest. So just giving folks, again, very high up, what does this look like in Vermont? So currently we have 7 entities who are providing Head Start services. 6 of those provide early Head Start services as well. These can be center-based program where the Head Start recipient holds the license. These can be partner programs where another entity holds the license. They can be collaborative within school buildings. They can be collaborative with family child care, and they can be home-based services as well. When we are looking at slots and enrollment of those kids, most up-to-date numbers, we've got 845 3 to 5 slots in Head Start. That's funded at a little over $15 million a year. And we've got throughout our early Head Start spots are a little over 500, funded at $11 million a year. So again, just saying these numbers big, right? We have $11 million coming into the state that is supporting this. If this goes away, it's going to leave some big holes. And I always like to stress the number of locations that services are provided, because people hear, oh, we have 7 Head Start recipients. There's 7. 7 hold the grant, and those services are actually provided in more than 80 locations. As I said, center-based, home-based, partners. I was trying really hard to get a map this morning, but as I said, technology was not my friend. So, but it's a beautiful map with many speckles and good, good coverage throughout the state. For those who might not know, Head Start services are within Vermont, within CAP agencies, mental health agencies, and a school district. So we've got Northeast Kingdom Community Action, we've got Southeast Vermont Community Action, Champlain Valley Office of, CVOEO, Champlain Valley Head Start. And then we've also got UCS Bennington County Head Start, Rutland County Head Start, which is with a mental health program. And EES in Bennington is actually a school district. So again, program, it's hard to talk about the program because we've got similar backbones, but it can look very different in different communities based on those needs. So let's get, because I know time's short, Renee, go. Big things, how we support local schools. So again, there's a lot of talk right now about pre-K and what that looks like and how Head Start is involved. Head Start has a long history of collaboration within school. So right now, all of our Head Starts, we are coordinating disability and transition services with all of our LEAs and receiving schools in Vermont. And when you're CVOEO and you've got 20 some odd districts in your area and each has a different transition plan and schedule and forms, that's a lot of work and a lot of coordination that's really happening. Our Head Starts are also providing over 1 million, just around 1 million in direct cash to these LEAs, whether it's teaching staff, we've got 13 FTEs in there, supplies, right, professional development, training. There are a whole host of benefits that schools receive there. We've got a little under 300 children who have actually benefited from those services in those placements, and our services are really focused on school success and positive transitions to kindergarten. The other big area for us, and again, I've got like 10 more, but I want to try to be brief, supporting children with developmental and behavioral needs. So we do lots of screenings, and we all know that prevention is worth more than intervention. So we're doing those screenings. Not only are we doing social, emotional, developmental screenings, we're also doing hearing screenings and vision screenings, which are essential. We're doing those referrals to CIS, to early intervention, special education, all those places. We're supporting those kids who have been asked to leave other settings because Head Start standards have a very lofty list of things that we need to do to support families. We're not kicking kids out. So there's a lot of, that's this big safety net there. Specifically, we've done over 2,000 screens. Almost a third of the children we screen end up needing a follow-up assessment or evaluation. Currently in our classrooms, we've got 1 in 4 early Head Start kids and 1 in 3 Head Start kids with a diagnosed disability. So that's the thing. When we talk about supporting educators and positive development, we're also a critical connector to families. So again, we're providing mental health consultation, referral to services. Oftentimes when child welfare is involved, we're extra eyes in the home, extra supports for that family. And we're doing a lot in terms of serving kids who are experiencing homelessness. Last year, we provided over 1,500 hours of those mental health services. We've got 300 children enrolled in Head Start just from our programs doing this. This isn't PIR data. whose families have disclosed that they have a mental health disorder, right? So we are supporting kids who are managing a lot at home, whose caregivers are managing a lot at home. We've got over 200 kids who are involved with child welfare. Again, we've got extra eyes, extra supports, trying to help that family, those families get stable, and those connections to homelessness services. So, we're bringing the plane into land here, 11 a.m. Local school districts are really going to face a lot of pressure if this funding goes away, right? Like we're not increasing this money anywhere else. It's into the system already. So there's going to be an increased need to manage those family stabilization services. And we've heard that conversation in the state for a while. Increasing school budgets and this feeling of like, we can't just educate, we're not, right? Like it's more than just educating in the classroom, it's family stabilization services. We are doing that in the system. If we go away, we're going to have increased caseload and demand for mental health, housing, crisis support, the child welfare, fewer screens, fewer kids ready for kindergarten. Special education systems, again, we know prevention is worth it, but if these kids aren't being identified early on and connected with those services, it's going to be more costly to the system up front. And Claire, great to see you on today. Great flashback, but love your message about keeping families at the center. And our Head Start programs, just as PCCs are doing, right? And there's all kinds of overlap there. We have a Head Start recipient who is a PCC, right? It's those relationships with families that are essential. And we all know that working in the field, you can have all the resources you want, but if you haven't built a relationship with that family, it's not going to be as meaningful. We've got those folks in place to see those go away and to require families to establish new relationships with different providers. You're just not going to get that same level of accessing services. What's the takeaway? I'm realizing now I'm rushing. We have until 11:30. I was thinking 11. So, yep. Okay, great. Well, keep Renee short when she thinks she does not have as much time. Key takeaways for you all today. We are really a node in the system, particularly between schools and families. And I don't think that that's always understood, that bridge work that we do in really ensuring that those vulnerable families are ready for school, that schools are ready for families, and that we're all doing the best we can to support. And we're not just childcare, we're not just slots, we're health services, we're mental health services, oral health. I had a number, I couldn't put a whole slide to it, but over 1,000 hours of tooth tutoring provided in our classrooms, right? So this is access to oral health care that these kids wouldn't get anywhere else. And the bottom line is it might be hard to put a dollar number on it. Trust me, I've tried. But if our capacity shrinks, the state will face wider gaps. And those families, when we talk about wanting to serve the most vulnerable, Head Start, that's what we do. It's not just low, right? It's not just under 100% of FPL. It's involvement in child welfare. It's homelessness. It's Reach Up, TANF, SNAP, right? All of these things. So it's really important that we put our money where our mouth is. And if we really want to tend and support those who are impacted the hardest, Claire, to your point, we really want to make sure that we're preserving our constellation of Head Start services in Vermont. So I'm gonna, boom, there's that. I didn't give Christy any time to get into the presentation because I rushed, but I'm gonna stop sharing. And then I left plenty of time for discussion for you all today. So I didn't have any prompts. Really, again, my goal was to try to illuminate on the full scope of the work that Head Start does in the state. And I would be very happy at this point to take questions about what that looks like. But I also see we've got some Head Start folks on here too. So,
Renee, do you want to just speak just briefly about the most recent notice that came about the reinterpretation of the POWERA Act? Some folks may have gotten a flash through their various advocacy contacts, but I think just a brief overview would be helpful.
Yeah, I can do my best. And that's what I mean. Things are moving fast, right? But we did just get, there was a notice posted on the Federal Register, the Personal Responsibility and Work Opportunity Reconciliation. That's the PROA. And it's really about the interpretation of the federal public benefit. So Head Start has always been exempt from that definition and that interpretation. which is why we got excited a few years ago when SNAP became a public benefit, and then we were like able to automatically enroll anyone who was on SNAP. What this is telling us is that that's flipped, and we are now considered a public benefit, and therefore we are not able to serve undocumented citizens. So there was and Christy's not here to speak to it, the Vermont Head Start Association did respond to a request from the press and has put out a statement, but it's really hard because, right, we got the flash, hey, you're all public benefit now and you can't serve anyone undocumented, but there's no guidance. What does that mean for currently enrolled? So again, my neck hurts and I'm trying to just keep it still and not jump around. But there are a lot of questions that need to be answered before Head Start programs make any changes. But yes, it certainly has folks feeling nervous. I mean, right, we can acknowledge here in Vermont, this is not as large of an issue for us as it is, for example, in Massachusetts, right now. So we're kind of in New England looking to our neighbors who are kind of leading the charge here to take a look at how that's interpreted. But at this point, we just kind of got the flash like, hey, you're now considered public benefit, which means, hey, you can't serve undocumented. So, but again, the message that I've heard from Head Starts is that we will not be making any moves and making any changes until the Office of Head Start issues federal guidance.
Renee, I'll just add in that it was because they're stripping away Head Start as an educational benefit, because that would be held up and has been held up by the Supreme Court as a right you can't mess with. And so if they redefine Head Start as a public benefit, then they can restrict access. So, and that is, I'll try to find the link, but it is open for public comment right now. I haven't gone back to look at the public comments yet.
Well, it is, but so with the what Christy put out from the association is actually that it's been posted on the register and states that it must be implemented immediately rather than taking effect after comment, which is normally the case. So again, right, because they changed the rules, I can't think of what it was called, but the whole process of public commenting has changed. So now it's been posted. They're saying, no, we're not waiting for public comment. This becomes effective immediately. You need to do it. And again, our Head Start programs are saying that might be coming from the feds, but we have not received any notification from our Office of Head Start in terms of program instruction or information memoranda, which are the only two formal things we pay attention to, saying how we would implement that change in Vermont. Other questions like, okay, well, I pull back, but yeah, what's going on up there? I don't know. I've got a bottle of Tylenol on my desk, but here in Vermont, right, we have in theory some more locus of control. So focus us here to Vermont, the services that are provided in Vermont, and just wonder if folks have questions, reflections. Did you learn anything new today, or what you got for me?
Well, Renee, that was great presentation. So I like just how you boiled it all down. It was awesome. Gave me a lot of context that I've been wondering about. So I just wanted to thank you for doing that. Gave me information that I wonder about, questions I get about Head Start. So thank you for boiling it down to the essential pieces. Bev?
Do you know how many families yet could be impacted by that change in the personal responsibility and work opportunity benefit?
Statewide?
Yes.
No. I do not, Bev. I do not have any estimates of what that number is.
Will that impact is it just impacting families and children who they consider illegal, or is it going to impact how families qualify? Like, will there be work requirements and things like that?
These are great questions, Linda. Unfortunately, we have not received any federal guidance about, right? Like, are they talking that we now have to collect document, right? And a lot of this too gets tied up in who's a federal who's a nonprofit, right? And again, because Head Start recipients can be all of these different entities, that means that the interpretation of that is going to look very different, even within states. So it's a big question. It's like, are they going to say that we need to collect this documentation to begin with? Are they going to say we need to do it on kids currently enrolled, or, you know, moving forward? Right now, you know, the strong piece about Head Start is the Head Start Act is in statute, right? And our Head Start program performance standards, right? Statute. So to make any of those change in theory would take a while to change eligibility. Like, you can't just change eligibility to Head Start very quickly. You go about it more of the rulemaking and the performance standards, and which were just revised in 2024. So the short answer is we really don't know what that will mean or what that will look like.
I'm just going to tag in real quick to say that there is a difference for the state's program that allows childcare for children of undocumented folks, and that is because it was intentionally separated as state funds that reimburse that, and so we don't have to enter any data into the federal system. So the state has sort of taken the stance of protecting those children by not intermingling federal money with that. So our reporting requirements are different. But that, of course, doesn't help Head Start.
Renee, is there any cadence to like the funding and when it comes? I'm just trying to like figure out, not that anything makes sense, but I'm just trying to figure out like when might be a time we know more. That's what I'm trying to.
Great question. I think, you know, overall Head Start in the federal budget, right, will follow those kinds of processes. Here in our state, right, it gets more convoluted. Not only are they all different entities, but they're all on different funding cycles, right? Because it's a federal to local program. So it's not that all of our Head Starts and right start here and end here. They're all different rolling deadlines. So to that extent, right, like I can use, I know EES in Brattleboro, I'll give it an example. Their funding year starts 7/1. They were TikTok waiting. They hadn't received a letter. I think their funding letter came in like 6/30 or like 6/29, right? For a 7/1 start date for a program for services to kids and families. So because of the regional restructuring of HHS, right? Like, we don't have our central person there. No one's approving that. All of what I heard, you know, Philly picked us up, including New York. New York has more Head Start recipients than all of New England combined. So what we're told, like, get in line if you're waiting for some communication, right? Because they're trying to handle New York now, and there's a federal hiring freeze. So there's no additional people coming in. The stacks of paper are climbing up. And, you know, so I've been trying to, Sherry, to your point, like, I've been working with directors about like, okay, who's up? What's your funding cycle? You know, NECA was another one that was due, I think, May, right? So it's more of an ongoing individualized basis of like, are we getting close? When would you normally see your letter? You know, and that kind of pestering. But there's no systematic way of, you know, keeping all of that on one timeline. But, you know, as we felt back with the budget uncertainties in the beginning of the year, right? And some Head Starts were trying to go and hit the button for payment and weren't getting payment. You know, Head Starts our roots are in this early childhood system. We are, right? We have connections with PCCs. Like, we have a PCC that is a Head Start. We are CAP agencies. We are school districts. Like, we are so embedded in all of these different places. If these services get pulled back, like it is putting, the structure, what I heard from folks, cap agencies, folks, they think, well, cap agencies, they have so much going on. I heard cap agencies say, if we lose our Head Start funding, our cap could go. The structure of our cap agency would significantly change. And I don't think Vermont has a good sense of that. We just think it's like a little program that's tucked in. But the amount of money, right? It is literally building, it's bricks within the mortar of these other things. And if we pull that out, we will see all of these other systems crumble because of the way that our small community nonprofits have really had to layer, right? Be very creative about layering funding and making those programs work. But I was shocked to hear, cap agencies say our complete menu of services and our staffing and all of these pieces would change considerably if we lost our Head Start grant.
I see Beth and Don both have comments in the chat. Do you want to add anything more to that?
Yeah, you're so right, Beth, in terms of that, right? And you've got history there. But yeah, we have used birth certificates, right? So again, it counts as a document, but maybe an immunization record might be a better way to go. So again, it's like we have to wait for the interpretation from OHS, and then programs are required to be working with their policy council and their board on making changes to the program that reflect that. So those types of things of like, well, maybe now our policy is that we're only looking at immunization records, right? They could absolutely do that. So, and then, yeah, right. UPK, yes, in terms of those, again, those slots, right? Like those are butts in seats. And I would say too, the overlap that you talked about too, Sharon, professional development, those figures that I threw up in terms of the money coming into the state, that's for direct service. That isn't the money that's coming into the state for training, technical assistance, professional development. And Head Start, that's open to our partners too. So it's also very, we start thinking about that. I didn't even put that dollar amount on the slide in terms of the professional development, training, technical assistance goes away. That's another huge hole because Head Start has great high quality advanced trainings, not just for educators, but for home visitors and family support workers. Like we have, there's a great amount of resources that are going into the system that I don't think, it'll just be eerie if those go away. We'll feel the draft. Kate, I'm seeing your comment in here too. Yeah, it's a jungle out there. But I realize that I am coming up on my real time. So I would just leave you all. You've got my contact information there. If you have questions or want to talk more, you have Christie's as well. She is currently the chair of the Vermont Head Start Association. So she can always speak on behalf of the association, whereas I'm just a little separate. But if you have any questions about data or coordination or anything like that, please get in touch, because my job is all about connecting and linking. So if something tickled your fancy here today, follow up with me about it, and we can figure out if there's some next steps or more information to be shared.
Thanks, Renee. I think also it would be helpful, we would welcome if there is like timely updates, to hear those from you, or to jump into a future meeting, any of that, welcome to do that as well. Any last minute questions for Renee? Thank you, Renee. That was awesome. I feel like I have so much more clarity. I've been trying to figure it out in my own head.
That's the best feedback I could get, Sherry. So even if all of you are dizzy looking at stars, Sherry said that it was clear for her. So I'm putting that on the
Yes,
belt
it
today.
was. I've been wondering about the impacts and this and that and how many and the sites and all of that. And I have never, I haven't seen that information, at least not for a long time. So that was really helpful, for sure. All right. So the final thing on the agenda, I will just spend just a few minutes putting it out there, and then the planning team for ELD is myself and Don Rouse and Anna and Jen Severance. And as we approach October, that will be changing. Definitely myself and Jen are going to not be part of the planning or the facilitating anymore. And BBF is, as they're looking at their new action plan and how committees are formed, kind of plays into what might the leadership of this committee look like. And also thinking about as those committees may shift or form or combine, or, I know BBF is looking at a lot of things related to the action plan. So there could be some changes there. So we're going to start thinking about the transition. I wanted to say that having a planning team has been great. So, we do want to keep a team of 4 with a BBF support person, 2 co-chairs, and a 4th person that helps with the planning, sometimes co-chairs, sometimes does some other work, but brings that another perspective to the planning group. So just putting it out there that we do like that format. We think it has worked. We anticipate it will continue to be like that in some fashion. If you have thoughts or ideas of people you want to recommend, or think about yourself, if you're like, hey, I would like to play this role or that role, certainly reach out to Anna or myself or Don, and we can think about that as we plan on what will happen next. We're also thinking about sort of how often the committee meets, and would like to get some feedback in the next month or so about that. I know BBF needs to take the whole picture in along with the changes to the action plan when they're thinking about how to best structure, but would be great to know what you think works best. Is it been about we've met pretty much every month, sometimes 11 times a year, sometimes 10. Do we want to change that? So those are all the things that we're going to be looking at and thinking about over the next few months, and thinking about how that might change or shift. So more to come on that. Would love some feedback as we get closer in the next month. The planning committee will meet again to talk about some ideas. And also, I want to leave a little time for announcements. So if anyone has any announcements they want to share, or any questions about the changes coming for this ELD committee, let me know. Thanks, Michelle. So any announcements or any immediate feedback as we consider how to structure ELD going forward in the fall?
Jerry, this is Cynthia. I don't have an announcement per se, but I just wanted to provide sort of some immediate feedback. And my thought is, I actually really appreciate meeting 10 or 11 times a year. I know that might feel arduous, but I think with all of the shifting landscapes, it might be even more important to at least hold those meetings in our calendars. And if we cancel them, great, we get time back. But reducing the meeting schedule, if something pops up and, Renee and her team really need some feedback from this committee and we have a schedule, we can do it. I think if we take them away, it'll be much harder to try to get them back in people's schedules. So it would be my plug to keep it and see what happens.
Thank you, Cynthia. I appreciate that. Anything else for today? I'll just give you a little sneak peek into August. We will be continuing the discussion on our 2026 policy recommendations. And then CDD would like a little bit of time on the agenda. So they will be coming. And Don, do you want to say what you're going to be doing, or are you still working on that?
No, actually, I'm meeting with Janet today to finalize the framework. So we're going to be talking about the annual payment framework. We're just finishing the internal structure of it, and you'll start to see sort of prep announcements go out the beginning-ish of August. So some of that's going to happen before we're able to present it to ELD, but we're just finalizing that with the idea that the payments would go out end of September / more like beginning of October, when we could get all of the applications processed. It will be an application opt-in process. So again, we're just kind of a little bit like the framework of readiness, but we had to tweak it a bit. So that's what we're coming to talk about. Everyone likes money.
And Don, this is money that will be coming to programs that fill out the application based on a formula you guys are working on.
Correct. It will be open to all programs, even those programs with 1 star, although the percentages of a bump that you can get are very different depending on your star level. So yeah, it's going to be a very simple, like I just built it's like, I don't know, 10 questions. It's very, people love the short applications. So we're going with what's been popular and worked. So I just finished that too. And I just sent it to Janet to say, okay, do you like all this? Is this good?
Awesome. So that'll be great. So we will talk a little bit more about that in August. This is the first time that process is going forward, and it's CDD has been wanting to be on the schedule, and the timing isn't lining up exactly perfectly, but it will be great to have a discussion, even if some of that has been implemented a little bit before that meeting. So thanks, Don. All right. Well, thanks, everyone. Enjoy the rest of your day. We will see you in August. Thanks for a great meeting.